Hey everyone, thanks for tuning in. Today I'm very excited to have Beth Powanda here on the call with me. Beth is an expert when it comes to Medicare insurance, and there have been some changes to Medicare that a lot of people are talking about, a lot of people are concerned about, and now it's the Medicare annual enrollment period, so a lot of folks are like looking at their plans and asking themselves, should I change? Do I need to change? And so Beth is going to take a few minutes and just talk to us about some of it, what is happening in Medicare today. Beth, thank you so much for joining me here today. What's going on?
Hey, thanks for having me, Seb. I really appreciate it. So right now, today is October 13th, so in 2 more days, we will be in annual enrollment. Starts October 15th, goes through December 7th. And there are a lot of changes that are happening, particularly with drug plans and Medicare Advantage plans, that people are very nervous and scared about, and they feel unsure. And so I'm getting a lot of phone calls. So basically, what's happening, I mean, some of the things seem like they're really bad, but they're not as bad as people think. So, first off, the Part D, which is the drug plans, that has been in the process of being redesigned now for a couple of years. This has been going on since last year, the Inflation Reduction Act. The best part of this is that it has reduced the maximum out of pocket. There used to be this catastrophic phase that people would call, for some reason, the donut hole, where the maximum out of pocket that people paid for their drugs was $8,000. So that has been eliminated, and the maximum out of pocket now is, well, it was 2,000 last year. This year's going up a little bit. It's 2,100. Deductibles are going up a bit as well. They're going from 590 to 615, so that has people very concerned. But they have to realize that their overall drug costs will be coming down because there are huge, huge reductions in negotiated prices for formerly very expensive drugs like Eliquis, Xarelto, Jardiance. Those drugs are coming down some as much as 68%. So what is happening is that the drug companies, the pharmaceutical companies, and the insurance companies are having to absorb this cost. And so as a result, there's been a lot of disruption. In some instances, they're increasing their premiums. Like one plan I know of is going from $20 to $70. Another plan that was $55 is going up to like $130, or they're just eliminating their drug plans altogether. So people have to scramble and they have to shop around for a drug plan. And the whole process can be extremely overwhelming, especially for people that maybe aren't feeling well. Maybe they're having cognitive challenges, or they're sick, and that now they have to think about making sure that they're going to get their medications. So if someone were to call me, I would ask them, you have to check and make sure that all their drugs are in the formulary, what their copays, coinsurances are, and I can take care of all of that if they just want to give me a call. So there's that whole component that we're dealing with just the drug plans. And then the Medicare Advantage plans, there's been a huge disruption in that area as well. Like here in Santa Cruz County, one of the carriers, Aetna, is completely pulling out. So anybody who has that plan has to get a new plan. Now, there are options, and I can explain them to them. Some of the options are limited, but they're doable. Like they may have to find a new doctor. They may have to start going to a different doctor's office. So again, I can certainly help them with that. So the important thing is that you really want to find a trusted advisor, someone who has your best interests at heart, someone like me who has been in the trenches now for years, who knows what doctors are accepting new plans, and know where to go for reliable information. That's the most important thing.
All right. So one thing that I don't understand, and help me out here, is like you say that the drug plans. So like, what's the difference between drug plans? Like some drug plans don't cover certain drugs, and
Yeah,
how does that work? So like, let's just say I'm on 3 prescriptions,
yeah.
and then all of a sudden I find that my drug plan no longer carries that, or the cost has gone up, or they don't offer this in my county anymore. How does all that work?
So every drug plan has to offer a drug for whatever your ailment is. Like if you need a blood thinner, then your drug plan, one drug plan might carry Eliquis, another drug plan might have Pradaxa in their formulary. So they will have some medication for whatever treatment that you need. So sometimes the formularies do change. Another time, the drugs are layered, are labeled as tiers. Something could be a tier 1 drug, which is a generic drug, going up to the specialty drugs tier 5. So there's copays and coinsurances vary based on the tier of the drug. So one insurance company, one drug plan may have a certain drug be a tier 2, and another company may have it a tier 3. So even though they both cover it, they may charge differently for it, which seems insane. I think that's crazy, but that's the way it is. I cannot solve the Medicare problems, but I can certainly help you navigate them. That's what I tell people.
Yeah, that all sounds really very complicated. So thank goodness that someone like you is around. And then you mentioned Medicare Advantage. What are the changes to Medicare Advantage? And for those who may not know, because I think a lot of people listening aren't yet on Medicare, or maybe they have parents who are, and they're trying to help their parents figure out what's going on. So
Right.
what changes have there been, or are coming up? I guess now that it's annual enrollment, what changes are coming up that families should know about Medicare Advantage plans?
So Medicare Advantage plans vary from year to year, and they have different types of benefits. Like some of them might have dental, they might have vision, they might have gym memberships, they may have transportation. So every year the benefits change, or they don't always, but oftentimes they do. So you want to check and see what the benefits are and how much those benefits are important to you. Like, does the plan cover hearing aids, or does it just cover a hearing exam every year? So yeah, there have been a reduction in benefits this year. We're seeing that. Some of the plans don't have the rich, robust benefits that they used to have. So yeah,
So are we seeing a lot of people sort of because are there other plans which maybe do have even better benefits, but they have higher premiums? I mean, is there still a robust marketplace for this, or are the options getting narrower and narrower?
it depends on what county you live in. Here in Santa Cruz County, we are considered a rural county, a rural designation. And so there aren't as many options here as there are in, say, other counties. Up in like Sacramento, Placer, Yolo County, they have a lot of options, a lot of different insurance companies. But we are somewhat limited here in Santa Cruz.
Okay, wow, that's interesting to
So
know.
it
So
depends on the zip code.
depends on so many things in life depend on your zip code. Funny how
Hmm.
that works, right?
Hmm.
Location. So do people normally go through like this change every year? I mean, you're in the Medicare insurance business. Do you
Hmm.
go through this with your clients like on an annual basis? Is this like a routine, or can people get
I
locked
do.
in and not have to worry about it anymore?
I do. Well, it depends on what plan they're on. Like if somebody's on a Medicare supplement plan, those plans are pretty solid and steady and they don't change. Their premiums go up. There are increases in the premium. So most people who are on a Medicare supplement are like, okay, I'm good. But they still should look at their drug plan. So I always look and check and make sure. I send out, starting in the beginning of September, I start sending letters and postcards to my clients, and I send them a needs assessment, and I tell me if there's any changes to your health. Are you taking new medications? Are you seeing any new doctors? Those are the things that I want to know. So yeah, I do. I do a review of pretty much all of my clients every year.
Oh, okay, so people should really plan on doing this as part of like
Absolutely.
their fall
Hmm.
quarter, to-do list. Oh,
Yep.
that sounds like a really proactive thing to do. So I'm going to ask people because I think that probably a lot of insurance agents wouldn't do that. I would imagine. I can't imagine that. I mean, I know from my personal experience that my insurance agent has not been very proactive with my own health insurance for my family,
Hmm.
and because of that, actually, I was out tens of thousands of dollars. Long story, but yeah. So
Right.
I would imagine that people really don't do that. Like this is kind of news to me. Everything you're telling me here.
So I'm fortunate enough that I work on a team, and I work with a bunch of other agents, and we all actually really help each other. We have resources that we can rely on, and I also have a customer service partner, and they're the ones that send out my drip campaigns to my clients. And like today, I spent a lot of time on the phone calling up people that haven't responded. Like, oh, I never get my email. My grandchildren are visiting. I haven't had a chance to check it. So I'm like, okay, well, just want to make sure you're aware of the fact that you're losing your plan. And they're like, what? You know. So now I'm going to send you a link to my calendar so you can schedule an appointment with me so we can go over your options. So yeah, I
Wow.
mean, I want to retain my clients. I don't want them to go somewhere else. So yeah, absolutely, I absolutely take care of them. You know.
Right. And you want to make sure that they that maintain their health, right? Obviously, because a lot of these times they're taking
Yeah.
life preserving medications, right? So it's very important to stay
Yeah.
up on all of this stuff.
Absolutely. Yeah.
All right. Well, that's terrific. So, if people want to get a hold of you to talk about, how they can make sure that their Medicare Advantage plans or their Medicare Part D drug plan is all in tune and not going to leave them in a lurch, what's the best way that they can get a hold of you?
Well, I can give you my contact information. Maybe you can create a slide at the end of this
I sure
presentation.
can.
Okay. So the best way to get a hold of me is to either call me or email me. Email's probably best, and I'm pretty much work around the clock these days. I'm working on weekends as well because I always tell people it's like being an accountant during tax season. We want to make sure everybody gets covered.
All right, very good. Okay, so I will put up your contact information here after the our chat is over. But I think it sounds to me like like because what I'm hearing is a lot of people are freaking out. And what you're saying is that actually you don't need to freak out. You just need to be a little proactive, take a few minutes, maybe longer than a few minutes, and go over everything with someone like you.
Thank you. Yes. I think what is upsetting and concerning to people is Medicare inexplicably seems so much more complicated than it really needs to be. And I think they're overwhelmed and they're afraid they're going to make the wrong choice because they are locked in. Once they make this decision by December 7th, they're stuck with it for the rest of the year. So I think that's the thing is they want to make sure that they've done their due diligence and they've checked to make sure that whatever decision they make is the best decision for them.
All right, and then you are the perfect person to help them with that. All right, Beth,
Well,
hey, thank
thank
you so
you.
much for taking the time. I know you've had a long day, and I really appreciate you taking a few minutes to explain all this to my listeners and my viewers, I should say.
I appreciate you too, Seb. Thank you very much.
All right, thanks, Beth. We'll catch you later.